Hi there, I'm Dr. Lamia Gabal-Shehab. I'm a urologist on staff at St. Joseph Hospital in Orange, and I'm here today to talk to you a little bit about a urologic disorder called interstitial cystitis. Interstitial cystitis is a diagnosis where the patient basically constantly feels like she has a urinary tract infection. It's urgency, frequency, and pain in the absence of a urinary tract infection. So basically the bladder is lined with a very nice mucus layer, protects us from all the things we're trying to get rid of. And for some reason, some women lose this lining. And it usually starts with a series of bad bladder infections. The bacteria eat away at that mucus lining, and we give you the antibiotics that kills the bacteria, but your body has to come in and rebuild that lining. And in some cases, either it never rebuilds or it rebuilds so thinly that now any insult makes you feel like you have a urinary tract infection when in fact it's irritation or inflammation. We know that there are several things that make this worse, including diet. Diet plays a big factor in this disorder, and so certain things to avoid in the diet to help would be caffeine, anything with caffeine, anything carbonated can irritate the bladder, anything spicy, and also anything acid. So we know that diet plays a part in this. Stress and anxiety also makes it worse. Hormonal changes make it worse. Sex can aggravate the discomfort. And also for some women, there appears to be an allergic component. So we know the things that make it worse. We know that it's also a very wide spectrum. There are some women over here who just pee all the time, and there are others over here who have severe debilitating bladder pain, and then there's everything in between. So for many of my patients over here, all they have to do is be good with their diet, drink lots of water, take a urinary analgesic such as Azo or Urabel, and their symptoms really improve. For others, sometimes we have to start them on a medication called Elmeron. It helps to recoat the bladder lining. Takes 3 to 6 months to see the maximum benefit, but definitely shows some benefit. And for my most severe patients, we bring them in once a week for 6 weeks. We do installations inside the bladder that help to recoat the bladder lining more quickly. Interstitial cystitis is a diagnosis of exclusion, so there is a series of evaluations that a patient needs to go through to make sure that there's nothing else more serious going on. If you or any member of your family is experiencing any of these symptoms, urgency, frequency, pain, in absence of a bacterial infection, then by all means, please talk to your primary care doctor to get a referral to a St. Joseph Hospital urologist.